Hello and welcome to the 2021 IEEE Rising Stars Global Conference. This is Phil Bautista and my guest today is Kent Dix, CEO and founder of Life365, recognized as a thought leader in the mobile and digital health space. He is one of the featured speakers of the conference today. Welcome, Kent.
Phil, thanks for having me on.
Absolutely, we're delighted to have you. Your session today, titled The Use of Technology and Solutions in an Overburdened Healthcare System with COVID-19 and Beyond, fascinates me. Can you tell me how the current pandemic has changed how we interact with our doctors and our healthcare providers?
Well, one of the things I think, pre-COVID-19, we were already on a pathway to kind of changing our consumer behaviors around healthcare. I've been in digital health for 15 years. There's a lot of things that and this is my second company in healthcare. We use the old adage, if you build it, they may not come. In healthcare, you've got to have a buyer, right? Somebody has got to be able, you can't just build a widget and then all of a sudden, it's consumed or used in healthcare. We had to struggle with reimbursement. We had to struggle with the fact of people actually adopting technology to use in healthcare. But one of the things that we started seeing prior to COVID-19 is that reimbursement was being put in place for you to be able to see your doctor remotely and a doctor being paid. Also that people were starting to use some type of technology to be able to connect with their doctor. And we call it telehealth or telemedicine, where you can actually on a phone or a tablet or a computer be able to see your doctor remotely instead of having to be face-to-face. Prior to COVID-19, there was about a 10% adoption of telehealth. It was slowly being reimbursed. But with COVID-19, it spiked to about a 70% utilization. And partly because that's the only way you could see your doctor. Right now, it's down to about 40%. I say right now that what COVID-19 did, especially in the consumer world and the technology world, is just accelerate everything that was starting to go anyway. So, if there was, a need for, for us to how we work, in commercial buildings or how we live or how we consume healthcare or medicine or wellness that's out there, or get our food on a regular basis or exercise, COVID-19 has changed that. So, the one thing that we've been on a path on with our company, and COVID-19 has helped accelerate it, is to help take the pressure off the healthcare system, to be able to remotely monitor people from a distance. And it's incredibly important, especially in a senior community or a senior application, that we monitor people from a distance, keep them out of the ER and the hospital, so that they're not exposed to COVID-19 and they keep the pressure off the critical healthcare resources.
Absolutely. Well, so can you tell me what the consumer and healthcare trends that you saw emerge here in 2020 and what 2021 will look like from your perspective?
So like I mentioned before, I think telehealth, where you have the ability, like me personally and my wife as well, we used to go to our doctor to get an exam. We used to have to go back to get a test. We had to go back a third time to get the results. A lot of that is changing, right? Because of telehealth and how we interact with our physicians and our doctors. You're also seeing doctors' practices starting to consolidate around healthcare systems as well. And those healthcare systems are now considering the community around them, not only their place where they get their patients, but now potentially the whole US, right, as well. I mean, think about that we've changed our behavior now about how we go after healthcare. But a health system like here in Phoenix, we have Banner Health and we have Mayo Clinic and we have Honor Health. It used to be the neighborhoods around you is when you chose what hospital to go through. In the future, with virtual care platforms and telehealth, your patients are coming from wherever throughout the world, right, from that as well. So connected solutions and technologies are going to be very, very important to these health systems. Instead of them building billion-dollar buildings, right, and campuses for healthcare, they now can actually go virtual and be able to pull people in from around the world. In 2021, I see that we're going to do more, not only of telehealth, and telehealth has usually been more episodic care like sniffles and flu. The one thing we're going to be migrating big time in the future is now chronic care. People that have diabetes, COPD, hypertension, chronic kidney disease, ongoing disease that stays with you for a long term, you need to be able to do remote patient monitoring to be able to get vital signs from the home, right? From me to be able to get back to the doctor or to an AI system so they can monitor you from a distance. So connected health through remote patient monitoring is going to be a big trend in 2021.
Absolutely. Those are all great points. Can you tell me how we can use technology to address the immediate need in the current COVID-19 burden on our healthcare system and the changed demand with consumer-driven healthcare? The I want what I want when I want it type of a scenario.
Yeah, I tend to answer this question up front where I say doctors don't need any more data because they're overwhelmed as it is, but analytic systems and AI systems do. AI needs a lot of data. And the biggest thing that we wanted to be able to do is to try, I usually show a chart that shows a hump. And on the left-hand side of the hump is health and wellness, the Fitbits of the world. Lots of people can wear Fitbits, little impact to healthcare. The right-hand side of the hump is people that are really chronically ill, very few people, but high dollars being spent on them. I don't know if your audience knows, but 50% of all healthcare dollars are spent by 5% of the population, right, in their last years of their life, last months of their life, actually. Where we want to get to is the middle of the hump, where people are newly chronic, newly diagnosed with it, not spending a lot of dollars, but we want to connect to them as lightly and cost effectively as we can. So my company before this was an IoT company, where we connected to wireless devices, Bluetooth devices, and we're be able to, in the background, send the data seamlessly into the background so that an analytic or an AI system can see the data and say, Kent's okay, I don't have to bother with him today, but maybe you want to look at Phil, right, instead. So my biggest thing that I usually say is one solution doesn't fit all. So it may be, a app that you can download to a smartphone. That would work for me. It would not work for my dad, right, or my mom. An IoT device potentially is preloaded, hands off, that just sits there and listens and gets data and sends it to the cloud. Probably would work for my dad pretty well. An application we can put on a smart TV, like an OTT set-top box, and be able to upload the data and wirelessly communicate, that works well. Or maybe a wearable device. We need to be able to understand from a human factors perspective what works really well with an individual and personalize their care.
Well, so you talk about wearables and IoT type of things. One of the things that I've seen popular with COVID-19 is a pulse ox monitor, right? And a pulse ox monitor is great, except I have to look at it and tell you, oh, gee, Kent, I'm like 98% sad or 78%, or I'm dropping whatever. Are you talking about connecting those type of devices through the internet for telemedicine and telehealth?
Yeah, absolutely. So the one, I was going to reach over and grab them, but the one thing I keep on my my desk at all times is wireless connected is a pulse oximeter, right? That has data that streams off of it. Is a thermometer on a regular basis that has Bluetooth wireless with it. And we also interface to the AliveCore ECG, right, as well. And I can take blood pressure, but that can constantly stream to the back end, and our analytics system can look at the data to say, maybe Kent needs to, check in, and I need to ask some more questions of him. Kent, have you been exposed to anybody with COVID-19 recently? Did you lose taste or smell from that? Have you been tested recently? Do you know if you have antibodies, right, from that perspective? I kind of keep this toolkit around me. When I start showing signs, symptoms, then I'll go out and make a double check to see if I need to go through and maybe do another test or see a physician.
Wow, that's fantastic. What a technological advance that you have at your fingertips right there. Can you tell me what impact your role in your company's had on the response and the handling of the COVID-19 pandemic?
I think we play a role, in that, like a lot of technology companies do. We have a great partnership with the largest ambulance company in the world, which is AMR Ambulance, and they are absolutely inundated with calls of picking up people and taking them to the hospital for COVID-19. I think we're facing, with certainty right now, because we're escalating so much on the number of people that are being infected, that the hospital systems are becoming overwhelmed. So, you really can't pick up people and take them to the hospital anymore. Now you've got to be able to send the ambulances out with nurse navigators and triage people at home, or take them to a secondary location and connect them to monitoring systems and monitor them from a distance. So, we have helped bring in the thought leadership of doing the connectivity. Again, I'm going to completely say that, one solution doesn't fit all. So we want to be able to, some people are asymptomatic and, won't even know that they've had COVID, on a regular basis. Some people we're trying to catch that they are symptomatic. Now we have a variant, virus that's coming in, and what kind of characteristics does it have as well? So we try to bring a variety of solutions into our partners so that they can actually monitor and be able to give greater access to care when the health systems are kind of overburdened right now.
Right. And I'm a senior consultant in IT, and a lot of the responses that I give to customers when they try, to architect a solution that fits everyone, my response is, one size fits no one. Right.
Mhm.
So, I mean, it kind of resonates with what you've just described. So we've got about 3 minutes left here. Can you tell me what message you would like the audience to come away with as a result of your session here at the Rising Stars Conference this year?
Yeah, the one thing I'm going to say really quickly, the easiest thing I do with my technology is I go out and give it to my father to use, who's not on the grid, who's not a technology person whatsoever, and make sure that it's something that he can use, right, from that perspective. And some people I give it to, it's their, especially in a senior category, are just wizards, right, on smartphones. They know more than I could ever learn about the smartphones. And other people, and it doesn't have to be just a senior, are people that just need it to be simple, right? I used to say the joke that I still have the VCR that flashes 12, right, all the time,
Right.
because the cobblers, children have the worst shoes, because you just want to make it darn simple, right, from that. And I think that's the message that I kind of leave with all this as well. We're seeing trends change. Healthcare systems are having issues adapting to the changes because they've built these billion-dollar complexes that are out there. Reimbursement kind of has to follow it as well. Here you have COVID-19 in the middle of it, but this change was already starting to occur. We've already seen people that are adopting change, like using services like Lemonade and Roman and Hers and Hims and other systems that are telemedicine systems that are out there because people want what they want when they want it. And this is going to be a very consumer driven market going forward in healthcare. You should be empowered with your own tools. You should be empowered with tools for your parents and your loved ones that are around you to be able to do that. You're going to be changing how you interface with doctors and the healthcare systems. I still think that we are missing the big boat in this industry where people can really get access to their health records and their loved ones' health records. There's a lack of interoperability from that standpoint, but I think it will actually start being straightened out hopefully here in the next 3 to 5 years, especially with Walmart coming into it, CVS coming into it, Apple coming into it, Google coming into it, Amazon. They're all the commercialization side of healthcare that are going to help try to put it in the terms that we can consume from a consumer standpoint and move healthcare closer to us and make it greater access to us as well. So the only thing I can say is healthcare is going to dramatically change here in the next probably 3 to 5 years.
Absolutely. Well, you've hit upon something that's one of my favorite topics. So that's disruptive technology, right? So the disruption here is you allowing people to be able to communicate with their healthcare provider without actually having to get in the car and go to the hospital. So they stay out of the hospital. So they stay away from the germs. The old saying, if you want to get sick, go to the hospital. What tremendous impact you and your company have had globally and an impact on our society. Thank you so much for being a speaker here at the Rising Stars Conference. I look forward to your session, and I appreciate your time on the interview today, Kent.
Thank you, Phil, for having me. I really appreciate it.
Thank you.